The patient came into the emergency room complaining of chest pain, and he was admitted by the hospitalist, and the hospitalist consulted us, cardiologists. And part of the workup that we did was a stress test, which he underwent. The results of the stress test was abnormal, which I conveyed to the patient and suggested to move on with the next stage of testing, which was a heart catheterization. After he got discharged, he had some problems walking, and that's when he presented to his primary care physician, which was the VA clinic. And that's how the problems with the blockage in the arteries in the leg were found out, and this subsequently led to surgery.
The essential nature of the claim was that the doctor failed to see the patient before discharge, and that as a result, he eventually developed an occlusion of the femoral artery. In other words, the puncture wound that was used to do the catheterization, the plaintiff argued, was not appropriately evaluated prior to discharge. We did think we had a strong case. There are several reasons. Number one is we thought Dr. Go would make an excellent witness, and that she was someone the jury would like and trust. One of the other great strengths in the case was the actual hospital chart. There were numerous places where the nurses were asked to chart whether there was pain. They always charted that there was no pain. They affirmatively recorded that they asked the patient, and he said he had no pain. In his testimony at trial, he said he had the worst pain of his life, and that he was telling everybody.
The main criteria for hiring our lawyers is the amount of cases that they have tried, the amount of cases that they have won, how well versed they are in the medical arena, and how committed they are to defending our doctors.
We worked with Dr. Go throughout the entire litigation. In fact, we met with her at the very outset. We prepared her for deposition. We kept her informed of the medicine and the testimony, and then we prepared her for trial. Throughout the case, we would provide Dr. Go with evaluations of what the other side, the plaintiff's experts, were saying, so that she could comment and, from a medical perspective, assist us in defending the claims that were being made.
This was a very complex case. It involved more than one doctor. It was very technical, and that's why we pay very close attention to one of our main weapons, which is our experts. If you want to win, you want to make sure that you have the best experts, and that's what we do in all of our cases.
The doctor's company was there from start to end, and very supportive, and I felt that they were in our corner. They were there even during the jury selection process. They were there observing reaction of the jury during the actual trial itself, and they were there to discuss the case at the end of the day.
The doctor's company provided us with all the support we needed to assist Dr. Go to be prepared to be the very best witness on her own behalf. And she did great, and the jury understood her and believed her and vindicated her in about a 2-hour deliberation after a 2-week-long trial.